Video conferencing in healthcare. How doctors and hospitals can use telemedicine to boost performance and patient care. Video conferencing has helped boost performance and service delivery in multiple areas, including healthcare. Let's see some key advantages of video conference in the medical industry and understand why hospitals and medical professionals throughout the world should implement telemedicine every single day. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing fantastic. I'm doing marvelous today. If you're doing as great as I am, go grab a cup of coffee or tea or vodka and let's roll. I want to talk to you today about how doctors and hospitals and the overall healthcare sector can use telemedicine to boost performance and patient care. Now, telemedicine provides less stress and fewer costs for the patients, right? Now, patients, particularly those with addictions, may often feel stigmatized for going to specialized treatment facilities, right? So if you have outpatient care via video conferencing, you can lessen the stigma and decrease the stress level of the overall treatment process. So hospital visits can be pretty stressful for a patient with disabilities, psychiatric issues, movement disorders. And again, the idea here is that you can reduce the stress and even eliminate it by doing certain examinations in a video conferencing format, right? A healthcare specialist can then decide if he or she needs to see the patient face to face. Now, if you use the right technology, and that technology exists today, patients can get monitored and treated from the comfort of their homes, surrounded by their friends and family. And everybody knows how important it is when you have a crippling disease to be surrounded by the right kind of people and have the right kind of vibrations, right? And I'm not even talking about the significant financial spending that comes with in-house hospital care, right? That also can be avoided, right? Now, if you think about it, if a patient has to move to a different country, but does not yet have that country's health coverage, right? In that case, the patient can continue his or her treatment by talking to the doctor from abroad via a video conference, right? And when he or she is ready and has the right health coverage, he or she can travel. All right. So you can use video conferencing in a lot of settings, including employee updating, patient orientation, general examination, right? So I'm giving you here just a small section of all the things you can do with video conferencing. So number one, telemedicine provides less stress and fewer costs for the patient. Number two, spending money on traveling becomes unnecessary. Everybody knows that healthcare is way expensive, too expensive in a lot of countries, right? And patients shouldn't be forced to pay extra to get to a specific location. It is therefore critical, at least that's what we believe here at Sweetie Kiwi, that not all patients live in areas with good public transportation have to go to a hospital. Now, some even they feel compelled to pay for the expensive cab service, right? In some cases, and that's very bad, some patients will just outright refuse treatment when they cannot afford to cover traveling expenses, right? And that refusal can lead to, disastrous consequences, right? Now, if you're lucky, if you're a patient and the patient has family around, family can help, friends can help, but not everybody has friends. Not everybody has family living with them, right? So this is very important that you're able to allow a patient to see a qualified professional, right, without spending money on traveling. Now, when it comes to traveling, the savings is not just on the patient part. Healthcare facilities also benefit. So hospitals, for example, when they do house calls, right, they don't have to pay anymore. They no longer have to pay one medic to go to a specific patient, right? Because you might think, that trip, those are small, it's just a small trip. It doesn't cost that much. But imagine if one trip costs $50 and you have maybe 200 or 300 such trips in a year, that adds up. That's 15,000, right? In the end, those trips do add up, and they become a substantial financial burden on even the most profitable hospital, right? So by implementing video conferencing in hospitals and clinics and research labs across the country, you're allowing doctors to examine and diagnose patients right from their office. And they, and only they, can then determine whether an in-person meeting is necessary. I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. I hope you are doing fantastic. I'm doing marvelous. I'm still continuing this conversation here. With telemedicine, doctors diagnose and treat much faster, right? Because the technology allows healthcare professionals to see more patients much faster, right? So, neither doctors nor patients need to worry about conflicting schedules, since video conferencing enables them to have an appointment whatever and whenever they want. Think about that. Think about the gain in productivity, the gain in flexibility, right? And patients are more likely to show up to their online appointment, even if something unexpected happened on that day, right? So it's a win-win. Hospitals are not losing money. Doctors don't waste their time waiting for patients that will never come. Okay. Now, medical professionals can be more productive because traveling time has been cut, right? We live in an industry and a globalized economy where time is precious. All right. So if you're able to cut down on traveling time, then medical professionals can spend their time allocating their energy onto more important issues, right? Think about the time wasted in traffic. Think about the time wasted in preparing for the doctor visit, right? The doctor can instruct the patient what to do while the emergency vehicle is on the way, right? Now, video conferences generally are much more effective than calls, because in some situations, in emergency situations, the doctor can see the patient and understand clearly what they are doing, right? They can even tell the patient or someone in the car, they can demonstrate their required actions. And this can be very, very helpful than just simply hearing the instruction over the phone, right? Think about the human part, the human aspect of it, right? Now, time is especially critical in rural areas where specialized doctors and hospitals are scarce, right? Now, if you flip it on the other side, in big cities, hospitals and doctors are not scared. They're not scarce. The problem is that you have traffic jam, right? So you change scarcity with lack of productivity, if you will. Okay, so video conference is a great way to sort of cover that. Now, next thing I want you to think about is that hospitals can maintain a cleaner environment in-house. How? People who end up being stuck in the registration room or the waiting room, for instance, they often spread their infections to other patients and doctors, right? So, medical students who visit hospitals to learn and train would, often involuntarily do the same. So video conferencing will actually solve that problem. So, hospitals can have a cleaner environment, and the patients also will be better off. Another thing I want to mention also, which seems to me very important, is that when it comes to using the technology is there. The features are there. It's just a matter of adapting the features that are available to the particular industry, to the particular hospital, to the particular clinic or rehab center, right? There has to be some kind of adaptation to see what works and what doesn't work. I'll be right back right after this. Don't go anywhere. Welcome back, folks, to another edition of Sweetie Kiwi. We're still here. And if you like the content's clarity and quality so far, please consider subscribing to our channel. We like to keep you as a loyal viewer and listener, and turn on the notification bell so you are informed the next time we drop a new show. We do this every single day, rain or shine. Also, like this content, share, and comment below. Now, number 6, telemedicine provides opportunities for better training and career opportunities. Now, you can use telemedicine to show medical students what to do, right? Let's say someone, you have a very famous doctor, a very famous surgeon out in New York, and you have some medical students in LA. Instead of having the student travel, they can just follow the intervention via video conferencing. So you can use this as a training tool, and that very famous and experienced surgeon can teach or can share his or her skills and experience with thousands of people throughout the United States or even the whole world. You can also use this in a hospital setting, for instance, when it comes to training the staff, right? You can use this also to help improve communications between employees, right? Because trust is crucial in the healthcare industry, right? So people need to act as a team and face challenging decisions on a daily basis, right? So the research has proven that telemedicine is a lot easier than other tools that we've had in the last 40 years when it comes to training. All right, so it goes by the whole, the old saying that says, don't tell me, show me, right? So instead of reading a book or just going through an audiobook, if you will, you just want to see it. You want to see how it's done. You want to see how an expert is doing it. So folks, this is really about it. Today we kind of covered how doctors and hospitals can use telemedicine to boost performance and patient care. And the recap here is that telemedicines provide less stress and fewer costs for the patient. Spending money on traveling becomes unnecessary. Doctors diagnose and treat much faster. As traveling time is cut, medical professionals can be more productive. Hospitals can maintain a cleaner environment in-house. Telemedicine provides opportunities for better training and career opportunities. Now, here's today's pro tip. We like to drop a pro tip in every show we have. In today's show, the pro tip is that I want to emphasize again the benefits for hospitals and clinics. Now, I've mentioned a few of them, but now I just want to really dig a little deeper here. There are countless benefits to video conferencing in healthcare. Now, every hospital should consider these perks. Doctors and patients find it easier to reconcile their schedules for video conferencing, right? Because the software does it automatically. Patients from remote locations do not need to spend time and money on travel. So if they don't do this, then it allows the hospital to be more productive because they can actually allocate more time on essential functions. Doctors can avoid house calls and save the hospital's time and money. Patients are more likely to get immediate help in an emergency, and doctors get better training from rare experts located in different parts of the world. That's what I just mentioned earlier with the expert in New York and the student team in LA. All right, now video conferencing will never completely substitute in-person checks, right? So the checkups will still be there, but it can significantly streamline hospital services and make treatment available to more patients, no matter their location, financial situation, and physical and emotional state. All right? Thanks for listening to me. I will speak to you another time. And until then, stay marvelous.